What do you have to start thinking about in your 40s and 50s when it comes to good health? We're going to have a great conversation, but if you want a more in-depth conversation, you can go to btmontreal.ca and click on our blog section. But joining me right now is Dr. Zachary Levine, ER physician with the MUHC. Welcome to the show. It's great to have you here. Let's first of all talk about, because there's some positives as you go into your 40s and 50s.
Absolutely.
What are some of those positives?
Well, the two that come to mind is, number one, you're treated as an adult more. I mean, you know, I've been out of med school for about 16 years, and this year I've only been asked once if I'm old enough to be a doctor, so that's a good thing. And the other thing is you don't care so much about fitting in, about, you know, the approval of others is not as important to you. So now we're going to talk about how you stay healthy. And that's really for ourselves now. It's not so we look a certain way to get approval of other people. So I think that's a really positive thing in your 40s and 50s.
Let's talk about our general overall health then in your 40s and 50s. Yep. What should we be concerned with?
Well, there's a number of things. So first of all, most people in their 40s and 50s are quite healthy. There's just a few issues that people should keep in mind.
Okay.
Number one is I always have to mention cancer, because it starts to rear its very ugly head. There's a few different types of cancer that come into play: lung cancer, prostate cancer for men, breast cancer for women. There's heart disease and stroke, which start to play a part. And then two other things that come to mind are weight gain. Unfortunately, most people do gain about a pound a year between 40 and 60.
Really?
Yeah, and the other thing is stress. So people stress and burnout, because people in their 40s and 50s are often caregivers for kids, for their parents, and also they have full-time jobs. And if you don't take care of yourself, it becomes impossible to take care of other people. So,
yeah, we're in that sandwich generation, right? Where our parents are needing care and our kids are needing care, and we're working, of course. We're well into our careers at that point. Absolutely. Let's talk more specifically. What should women specifically be concerned about? You touched on one, but what are some other things they should concern themselves
So the four things
with?
I mentioned are true for both men and women. Specifically for women, menopause happens in their 40s and 50s. And with menopause, there's changes, there's mood changes, there's temperature changes and hot flashes, and there can be urinary problems too. Especially women who have had multiple children, they can have some urinary leaking or incontinence. And some women are embarrassed, they don't want to talk about it, but it's very, very common.
Yes.
So the important thing is talk to your doctor, because there's treatments available. And
I was just wanted to mention menopause. When it comes to menopause, what can a woman do about that exactly?
Well, I mean, certainly lifestyle actually does help quite a bit. You know, talk to your doctor. There's certain dietary things, and exercise helps a lot. And then if necessary, there are definitely medications. There are medications that help with the hot flashes. There are medications to help with the mood swings. So there are many different things available, and it's not necessarily medications. A lot of times lifestyle can help very much as well.
Let's move on to men. What should men specifically be thinking about as they move into their 40s and 50s?
Well, the prostate starts to rear its head, so basically men may start to have symptoms from that, and it's actually the opposite symptoms. Usually, if the prostate enlarges, the problem is that men have trouble getting the urine out. So it's not incontinence. They may have trouble getting the urine out. Sometimes it can get completely blocked, in which case they end up coming to the emergency department. And then they can also start to get urinary tract infections. At younger ages, it's much more common for women to get urinary tract infections, but as we get older, us men catch up in that regard.
You mentioned prostate. Of course, there are screening procedures for many of these things that you're talking about. What sort of screening should you start looking into in your 40s, and then maybe we'll move into our 50s? Is there anything you should look at in your 40s?
Yeah, absolutely. I mean, the things to think about, what really matters is you personally. So I think it's important to start. We talked about getting a family doctor last time. In your 40s, really, it's good to have a family doctor and talk to your family doctor about what you should be having. It's very individualized. So because a lot of the screening tests, like for your blood pressure, like for your cholesterol, like for diabetes, a lot of them start in your 40s and early 50s. But it really depends. If you have a strong family history of heart disease, for example, then probably you should start to get your blood pressure checked, your cholesterol checked, your glucose checked, which is for diabetes, earlier. And it's the same thing for cancer. So if you have a strong family history of cancer, the screening tests, like for colorectal cancer, where most of the recommendations are as of 50, but if you have a strong family history or another risk factor, then you should start getting your testing earlier.
And into your 50s, should you be getting that colorectal, that prostate exam done every 3-5 years? What is best?
For colorectal cancer, the recommendation in general for most people is to have the fecal occult blood test. So basically the stool test. There's another test called a FIT test, but basically get tested every year. Test your stool for blood. You shouldn't have blood in your stool, a significant amount. There's other tests, so mammograms for women. is as of around 50, depending on who you ask, around 50 every couple of years. Again, it depends on your family history, and you have to talk to your doctor about it, but approximately every couple of years for women, the breast cancer screening. And then for prostate cancer, you really have to talk to your doctor because the PSA test and the rectal examination are quite controversial, actually. But some people are really pushing for them. Like Ben Stiller had prostate cancer recently, and he's a big proponent of the PSA test because it caught cancer early, and that's the point of these screening tests.
Absolutely.
But you have to realize that you may have a false positive, which means you have a positive test. You have to go for other testing, like biopsy, which can cause bleeding and discomfort, and you may not have cancer at all. So you just have to realize that before you go for the screening test.
Dr. Zach, always a pleasure. Thank you so much. And Dr. Zach will be back to talk about our 60s decade, what health issues we should be thinking about then. If you want to find out more in-depth information, visit btmontreal.ca/blog. We'll be back with more after